Have you ever noticed strange rashes on your skin that don't itch, or felt very tired for no clear reason? Maybe you've had a sore that disappeared on its own and thought nothing of it. These could be early warning signs of something more serious, like syphilis. Syphilis is a hidden infection that often starts quietly, but can grow into big health problems if not treated. It spreads easily through close body contact, especially during sex. If left alone, it can sneak into your body in stages, harming your skin, brain, heart, and more. The good news, it's treatable if caught early. So, if you've ever brushed off a small sore or rash, this might be a good time to learn more. So what actually causes syphilis? Think of it like this: imagine a tiny germ too small to see sneaking into your body through tiny cuts or sores. The germ responsible for syphilis is a corkscrew-shaped bacterium named Treponema pallidum. It's like a tiny spiral invader that spreads mainly through vaginal, anal, or oral sex. It can also pass from a pregnant mother to her baby. Once it gets in, it travels through your bloodstream, quietly setting up shop in different parts of your body. You might not feel anything at first, but it's already on the move. Examples: say your partner had a painless sore you didn't notice, and you kissed or had sex with them. That could be enough for the germ to jump across. No one plans to get sick, but knowing how it spreads helps you stay safe. Now let's talk about how your body reacts in the secondary and tertiary stages. In the secondary stage, you might suddenly notice a rash, often on your palms or soles, that doesn't itch. You might feel like you have the flu, fever, sore throat, swollen glands, and extreme tiredness. Some people even lose chunks of hair. Here's a scenario. Imagine you're preparing for a job interview, and your hands break out in a strange rash. Doctors might first think it's allergies, but if you had a small sore weeks before, it could be syphilis. If untreated, it goes into hiding for years, then returns as tertiary syphilis. This stage is dangerous. It can slowly damage your brain, nerves, heart, or bones. Example: someone starts walking unsteadily or forgetting things, not because of age, but because untreated syphilis damaged their nerves. These symptoms don't show up overnight, which is why catching it early is so important. How do doctors find out if you have syphilis? They don't rely just on symptoms, they test your blood. Simple blood tests can detect if your body has made antibodies to fight the syphilis germ. Sometimes, if there's a sore, they might take a tiny sample to look at under a microscope. Think of it like solving a mystery. The clues are in your blood. The best part: syphilis is usually curable with antibiotics. Most often, a single shot of penicillin can stop the infection, especially in the early stages. For people allergic to penicillin, there are other medicines. But in late stages, you might need more doses or even IV antibiotics. Example: say you tested positive. Scary at first, right? But after treatment, follow-up blood tests will show the infection fading, like watching a storm move away. That peace of mind is worth every step. Can syphilis be stopped before it starts? Yes, and it starts with awareness and action. The best shield is safe sex, using condoms or dental dams every time you're intimate. It's like wearing a seatbelt. It doesn't guarantee 100% safety, but it greatly lowers risk. Also, regular STI checkups are key, especially if you have new or multiple partners. Imagine you and your partner both get tested before becoming intimate. It's a sign of care, not mistrust. Pregnant women should be tested too, to protect the baby. And if you're diagnosed, tell your partners so they can get tested. It's not about blame, it's about protecting each other. Small steps, big protection. Scientists aren't giving up on beating syphilis. Even though it's old, it's making a comeback, so research is heating up. One big focus is faster, easier tests. Imagine a simple finger prick test at a clinic that gives results in minutes. That's already being used in some places. Another advance, studying how the syphilis germ avoids the immune system to help create a vaccine. Yes, a vaccine for syphilis could be possible one day. Example, in some clinics, pregnant women in remote areas now get quick tests during checkups, helping stop the infection before it harms the baby. With better tools and more awareness, we're closer than ever to turning the tide against this silent invader.